What should we do, doctor? I asked Dr. Mike, a very experienced doctor. What has happened? Dr. Mike asked me back. I think there is something wrong in his cardiac. It's cardiac tamponade. I answered him quickly. Stop the bleeding with the stepless first, Dr. Mike said to me. What? Me? Here? I'm surprised with his word. Yes, he answered simply. Mike, are you kidding me? She even can't operate the patients properly. She will get fainted or maybe feel nauseous, and we cannot operate this patient in here. It will be so risky, said Dr. John to Dr. Mike. The operating rooms are full right now. This is the only way to do first aid to patients while waiting for the ongoing surgery to finish. John, if you believe that you can solve the problem, you will find a way to overcome that problem. Do not be afraid. I'm sure she can handle it, said Dr. Mike. He seemed very trust me to do this surgery. Small hospital with 2 operating rooms. The place where I am placed as a punishment because I've got fainted in operating rooms during the operations in my old hospital. Yes, I am a cardiologist, but I will feel nauseous when dealing with surgery and operation, so I always take medicine for my nausea before doing the operations. I was very good at written exam than practical tests when I was a medical student, which make me think that it's the reason why I can graduate from medical school. After a long time, no one trusts me to do the surgery. I was stunned when Dr. Mike trusted me at this crucial time. This made my confidence is back. Look after him, please. I will prepare myself to do this surgery, I said to the nurse, which are in the same room with me. I rushed into the doctor's preparations room and changed my clothes into operation wear. I looked at my nausea medicine, which is made by Dr. Mike for me when he found out that I fainted during the operations in my previous hospital, and take 2 pills. After getting ready, I returned to the emergency room. Close all the curtains. I ordered the nurse in the room to close the hybrid room curtain. Give up if you can't do it. You don't need to force yourself, Ness, said my friend who will help me to do this surgery with worry. Dr. Mike wants me to do it. If he tells me to do it, it means he trusts me, Kay. I told her while using blue suits as a sign that I was really going to do this emergency surgery. All right, I trust you too, Kay said in a tone that she was still worried. I looked at the patient in front of me. I knew there was something wrong with his heart when I did a scan in his chest area. I took my breath slowly and exhaled again. Scalpel, I said, and asked the scalpel from the nurse. I began to dissect this patient's chest. Bovie, I said to the nurse. Sterasol, I said again to the nurse. But there was no response. I looked at the nurse who was staring at Kay. Give it to me, I said to convince them. Nurse rushed to give me a sterasol. I began to cut the patient's ribs to see the patient's heart using a sterasol. Sternal retractor, please, I said, and the nurse gave it to me right away. I paused and convinced myself to do this, and I immediately placed the sternal retractor on this patient's body to support the incision in his chest so that I could clearly see the patient's heart. This time there will be a lot of blood. Prepare enough gauze and prepare sections and staplers, I said to the nurse and Kay. They all nodded in agreement. Scissor, I asked again to the nurse. I began to cut out the pericardium, the thin membrane covering the patient's heart, and bleeding occurred. This is normal for the patient who has cardiac tamponade, but I got panic and worry if I feel nauseous because of a lot of blood. Do you find it? Kay said while holding the suction device to suck this bleeding. I paused, trying to wipe the blood using gauze while squinting my eyes toward the cardiac of the patient, hoping to find the gap that causes this bleeding. "Please, stay calm, Nancy," Kay said. She saw me in panic and sweating. "I find it," I said with enthusiasm after finding a small gap. "It is like 1 centimeter in the right ventricle of the patient's heart that causes this bleeding. Staples." I immediately stapled the gap so it wouldn't bleed anymore. "How is the vital sign?" I asked the nurse. 90/40, and the heart rate is 100. The nurse answered quickly. I breathed with relief. "I think we're fine," I said, staring at Kay, who was panicking. I saw her breathe freely. Dr. Mike said that the first operation has finished and asked us to move these patients into operating room. A nurse said right after she received the information from the telephone. I and Kay immediately cleared the surgery that we did and moved the patients into operating room. I met Dr. Mike there. "Good job, Nancy," he said, smiling at me. "I know you can do it," he said again. I just smiled at him, proud of myself. We began to enter the operating room. I became Dr. Mike's assistant this time because I was the one who stopped the bleeding from this patient's cardiac. The operations went smoothly. I rested in the doctor's restroom and sipped my coffee. "May I ask?" I was surprised with the voice, which is very familiar to me. "Dr. Mike." "Absolutely," I answered. "Did you take the nausea medicines that I gave to you?" asked Dr. Mike. "Of course. If not, I cannot finish the surgery, Doc," I answered him again. He smiled and said, "What's wrong with you all this time? How can you be nauseous and fainted at the hospital, Nancy?" asked Dr. Mike, half laughing. "What do you mean, Doc?" I asked, confused. "Hey, what I gave to you is not a nausea medicine, but just a vitamin, Nancy," answered him with a happy face. I was speechless. "All right, we have to take a rest. See you tomorrow, Ness," said Dr. Mike, who left me, who was still speechless and shocked. I don't believe the facts that I just heard. I only take vitamins instead of nausea medicines, but I did not feel nauseous at all when doing the surgery. I closed my eyes, trying to understand what had happened, and then I realized that all I needed was confidence to do something. My confidence arises when people trust me if I can do something, and Dr. Mike trusts me to do the surgery.